Hi, I'm Dr. Rodríguez-Feliz. I'm a board-certified plastic surgeon here in Miami, Florida. Usually I do these videos to educate other patients, and today I'm actually going to be the patient. I want to take you through the journey to restore my beard with the beard transplantation. A beard transplant is a procedure very similar to hair transplantation in the scalp. In most males, the harvesting is done with a FUE technique, meaning we harvest individual hair follicles from the back of the head, and then eventually it's done either to increase density in patients that already have a beard, or in some patients that can't really grow facial hair, you can actually restore a full beard in many cases in multiple stages or multiple procedures. But it's essentially a way of transplanting hair from the back of the scalp into the beard area to increase the density or create a beard in patients that can't grow one. I've been wanting to grow a beard first for a few years. Actually, my dad, my brother, they both have beards. And I thought I never could grow one, but I would say last vacation, obviously I didn't shave for a couple of weeks. And when I came back, I was like, well, maybe it's a great time to just shape what I grew and see if I can at least grow a beard. I actually started doing some reading, and I figured that it takes patience. Before that, I would just grow my beard for about a week, and I felt like I couldn't grow one. So after reading that you have to be patient and just let your hair grow, then I decided to just not shave. And I was actually liking the appearance. I was getting good compliments from patients, from people, and I actually felt I can grow a beard. But eventually what I noticed is that I had to leave my beard hair grow longer in order to cover some of the spacings that I had noticed or I was noticing. And that really was wait a second, I think I am a good candidate for a beard transplant. And in my practice, we offer this for patients, so I figure, why don't I just get one? So in reality, the big decision maker is like, I started to look how I look with the beard, but I wanted to increase the density so that I can keep the hair short and still have a very nice, dense and even beard while I had it short, which it was my preferred way of having the beard. I'm hoping with this procedure I can actually increase the density in certain spots. For example, when I didn't think I can grow a beard, I actually had done laser hair removal, mostly in the submental area. So after growing the beard, I noticed I have several spots that were bald, that had no hair growth, and I needed to, I guess, let my beard hair grow longer than what I would have liked just to be able to cover them. So that was one of the main reasons why I wanted to do the transplant. It's just to fill in some of the balding spots from my previous laser hair removal so that I can actually have a beard and just keep it short and still have good density throughout. And then I also, obviously, as you start growing your beard, then there's certain either appearance that you like, and I like to wear my beard maybe a little bit higher on the cheek area, but I noticed I was missing some spots in there. Also with the new haircuts, I actually like when they fade into your beard. The fade actually gets into your beard, but I had a lot of decreased density in this area, so my barber told me it was not possible to do, or maybe not as I wanted it. So I figure this procedure will help me accomplish a few of the things that I've been wanting to do to just improve the appearance of my beard. Beards definitely accentuate the jawline, which is one of the most important features in a male face. And it is supported by the literature actually that a strong jaw gives stronger or more confident appearance in men. In my particular case, I have a more retruded chin, And I've noticed that with the beard, actually, I can create a more sharp angle to my jawline, which definitely has resulted in some boost on my own confidence. So one of the things that I always tell patients is that I myself, I'm a patient actually. I'm a believer that when you look good, you feel good, and that's how you can perform at your best. So I definitely feel appearance plays a role in a person's, I guess, either development or well-being, which eventually will translate into feeling good and performing at your best in whatever role that you have. So I have done cosmetic procedures, including Botox, fillers on myself. I've had skin resurfacing. I use skincare product. I have done actually a previous hair transplant in my scalp in the crown area. And I just have experienced myself what doing cosmetic procedures can do to boost your confidence, and I feel it's great. And here I am. Now I'm doing my beard transplant, and I'm actually very excited for it.